Well, good afternoon, everybody, and thank you for joining today's update on COVID-19 in North Carolina. As of today, North Carolina has had 733,000 confirmed cases, 5,587 new cases since yesterday, 3,305 people in the hospital, and sadly, 8,915 people who have died. Our prayers go out to those who've lost loved ones or who are battling this virus. Today, we're encouraged to see that our COVID numbers have stabilized in recent days, and that's good. But the reality is that they are still high, and that too many people are still falling seriously ill and dying. The virus is still raging through our communities. With more than 3,300 people in the hospital, and the percent of positive tests in the double digits, we know this virus is still spreading. And with at least one more contagious variant of COVID-19 in our state, we still have work to do. We cannot let our guard down, especially in these cold winter months. That means we need to keep wearing our mask and practicing social distancing when we leave our house. Now, you've heard me say this a lot, but it's because these simple measures have and will save lives. Even as we continue our prevention efforts, the top priority in our state is getting vaccines to people as quickly and as equitably as possible. As of today, North Carolina has administered 99.8% of all the first doses that we have received from the federal government. I'm grateful to the Department of Health and Human Services, Emergency Management, and health providers across the state for working hard to get these shots out there. The sticking point right now for our state and the nation is not enough vaccine. We do have thousands of shots, but there are millions of people who need 2 of them. Yesterday, we got some good news when we learned that the federal government will increase vaccine shipments to the states by 16% over the next 3 weeks. That will help, but we still need much more. I know this is maddening and frustrating for many of you. Hundreds of thousands of you have had success in getting vaccinated, but many more of you haven't been able to get appointments or have been put on waiting lists. Trying to get someone on the phone and long wait times, I know that's frustrating, but it will get better as the state gets more vaccine and more providers giving it out. And until we do, we all need to keep up with these 3 W's. Plan and wait for our turn, as hard as that is. I want every single North Carolinian to be immunized to prevent this cruel disease. North Carolina will make sure everyone has a spot to get their shot. This pandemic has strained our patients, but also our economy, and many people are struggling financially. We set up the HOPE program to relieve some of that strain by assisting with rent and utility payments. As of this week, the HOPE program has paid nearly $130 million to landlords and utilities on behalf of more than 34,000 low-income North Carolinians who faced eviction or utility shutoff. With the General Assembly back in session, I hope to work with these state legislators to appropriate recently passed federal funds to keep helping people and small businesses that are hurting. There is significant need out there, and we hope to provide additional funds to expand the HOPE program. At this time, I'm going to ask Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, to give us an update on our COVID data. Dr. Cohen.
Thank you, Governor. It's been a while since we've had a day-to-day, so let's dive in. As a reminder, we look at a combination of trend metrics. We look at COVID-like syndromic cases, new cases, positive tests as a percentage of total tests, and hospitalizations. On this first graph, we look at people who have come to the emergency department with COVID-like symptoms. This is our earliest detection mechanism. And you can see when looking at that yellow line, it has trended downward over the past 2 weeks. However, you can also see it is still well above where it was earlier in the pandemic. Next, we look at new COVID cases. This first graph shows you the trajectory of new cases each day since we had our first case back in March of last year. Like the previous metric, this still is way too high, but has been decreasing since its peak on January the 10th. If we narrow in on the trajectory of cases from early December through today, you can see a clear picture that our cases are starting to level, and they're back to where they were in late December. Next, we look at the percent of tests that are positive. This graph also goes back to the beginning of December. Looking at the yellow line, our percent of positive tests is leveling at about 10 to 11%, but this is still well above our goal of 5%. On our next graph, we look at day-over-day hospitalizations. This graph also is from early December, and you can see looking at that yellow line, this trend has decreased just slightly, but we're still well above where we were in December. Okay, so in summary, here's where we are. Surveillance data has decreased, but remains very high. It does get a red X. North Carolina's trajectory of cases is leveling, but still well above where we were most of last year. It gets a red X. North Carolina's trajectory and percent of tests returning positive is leveling, but is well above our goal of 5%. This also gets a yellow line. And North Carolina's trajectory of hospitalizations is leveling, but way too high. It gets a yellow line. The overall takeaway is that we are past the spike from the winter holidays, but we are still experiencing worrisome levels of virus. This worry is compounded by the fact that we now have a new, even more contagious COVID virus strain in our state. The 3 W's are as essential as they have always been. Remember, people can have COVID-19 and not know it. The best way to protect those around you is to act as if you have the virus and could be contagious. That means always wearing a mask over your mouth and nose, always waiting apart from others, and always washing your hands frequently. Look, I know people are tired and stressed. This has been a hard year. Please know that help is available. Anyone in North Carolina can call the Hope for NC helpline at 1-855-587-3463. That's 1-855-587-3463. It's help available 24 hours a day, 7 days a week. We also have a new COVID community readiness toolkit to help people find mental and behavioral health supports and resources in their community. Having vaccines in the state is also offering those glimmers of hope, as does seeing our vaccine providers come together to get vaccines to people as fast as possible. They achieved an important milestone today. As the governor mentioned, vaccine providers have administered 99% of all first doses in the state, putting North Carolina in a strong position to advocate to the federal government for more vaccine as they become available. As the governor shared, we learned yesterday that we would see an increase of about 16% in this coming week's supply. Even with this increased demand for vaccine vastly exceeds our supply. And I know it's frustrating to have to wait, but everyone will be able to get their shot as vaccine supplies increase over the next several months. Keep doing those 3 W's and staying home so we can slow this virus down while we get everyone a spot to get their shot. Thank you, Governor.
Thank you, Dr. Cohen. And while it's good to see our numbers are decreasing and stabilizing, as she said, they remain too high. We need to keep up our efforts to slow the spread of the virus. Today, I'm announcing that we will extend our modified stay-at-home order until February 28th of 2021. That means the 10 p.m. curfew is still in place, as are the mask mandates, mass gathering limits, and capacity limits for businesses and retail. If people follow the safety protocols, they reduce their chance of getting sick and infecting others. I'm also extending a moratorium on evictions to help people stay in their homes during this pandemic. Health experts have shown us that keeping people in their homes is an important way to slow the spread of the virus, and an evictions moratorium is important as we remain under a modified stay-at-home order. And to support businesses working to serve customers during difficult times, I will extend the order to allow to-go and delivery sales for mixed beverages. Those orders will be in effect through March 31st, 2021. Although we're often frustrated and weary, we're entering a time of hope. The vaccine team and healthcare providers are working night and day getting more vaccines to people, and more are on the horizon. Our COVID numbers are stabilizing. We are charting a path forward, but we have more work to do. Let's continue wearing our masks, working hard to get people vaccinated, and taking this seriously. If we work to keep ourselves and each other safe, we will defeat this virus and move to better times ahead. At this time, I would like to recognize our Director of Emergency Management, Mike Sprayberry, to give us a brief update on the weather situation. Mike?
Thank you, Governor, and thank you for your outstanding leadership. Today is day 324 of the State Emergency Response Team activation for the COVID response. We're closely monitoring an incoming winter weather system which will bring snow to parts of North Carolina beginning tonight. Rain will change to snowfall beginning around 10 p.m. in our western counties, and snow is expected to arrive overnight for portions of our central and eastern counties. While the greatest accumulations are expected at higher elevations in the mountains, several inches of snowfall are also possible across northern portions of central and eastern regions of the state. Our advice is for everyone to closely monitor the forecast for your area. We know that winter weather is very difficult to predict and can change abruptly. If you're in an area that gets significant snow accumulation, please stay off the roads unless you absolutely have to travel. This will allow state and local crews to clear the roads. Since this will be rain turning into snow as temperatures drop, DOT is not brining most highways for this event, as the rain would wash that salt solution away. But their crews are prepared to quickly clear roads where snow or ice accumulates and to spread salt and sand where needed. Please take the time today to make sure your home, your family, and your vehicles are prepared for winter weather and exercise caution if you must travel in hazardous conditions. Thank you very much. Thank you, sir.
Thank you, Director Sprayberry. Also with me today is Secretary of Public Safety Eric Hooks and Commissioner of Prisons Todd Ishii. Monica McGee and David Payne are our sign language interpreters. And behind the scenes, Jackie Mativier and Erica Kugler are our Spanish language interpreters. We will now take questions, and if you can state your name and your organization, we would appreciate it, and we'll take the first one.
Our first question is from Laura Leslie with WRAL.
Hi, Governor. Are you able to hear me okay?
Yes, I can.
Great. Thank you. Thanks for taking my question. When do you anticipate that the state will have enough vaccine to move into the next phase, to finish out the phase that we're in, I should say, and move into the next phase of vaccinations?
I don't think we can exactly predict that yet, because although we know what the vaccine coming is for the next 3 weeks, we're hoping for additional vaccine coming later on. We want to make sure that we get most of the people in phases before we move to the next one. Dr. Cohen, I'll let you elaborate on that a bit if you would.
Hi, Laura. We're working with our vaccine partners on that right now. We've actually asked them the question about how they are seeing demand on the ground. Are they still seeing the high levels of demand for those who are 65 and up, and from our healthcare workers, which is the current folks we are vaccinating? From what we have heard from our providers so far is that there is still a lot of demand from that group. And so we don't anticipate moving forward quite yet. But we want to make sure we are continuing to move quickly and make sure that we are doing what we did in this past week, which was get all of those first doses out into arms each and every week. So before the next shipment from the federal government comes. So we'll be monitoring that very closely, looking at our data, working with our vaccine providers, and then we'll be back in touch as we are able to move from one category to the next. Thank you.
Next question, please.
We have a follow-up, Laura Leslie, WRAL.
Thanks. Just to follow up, we have been hearing from folks who have had their vaccine appointments canceled. Obviously, a lot of disappointment out there. Is there anything you'd like to say to those folks?
Sure. I know that it is frustrating for people. They want their vaccines and they want them now because they will help protect you from this deadly disease. The biggest problem we face right now is that we have millions of people who need it, but only thousands of shots. So I ask people to continue to call, to continue to work to try to get an appointment. And we're encouraging providers to, as much as they can, do an appointment schedule situation. And I would say to them that people are working night and day to get enough vaccines so that everybody can be vaccinated, and that there will be a time for you to get your shot. And we're going to continue to work to make sure everybody in North Carolina is vaccinated as quickly as possible. And they've been working all this week to make sure we get rid of all of our first doses and get people vaccinated and can turn to Washington and say, North Carolina needs more. And that's what we've done. Thanks. Next question, please.
Our next question is from Paige Peroso with WBTV.
Hi, Governor. Thank you for taking my question. This is Paige Peroso from WBTV. The CDC recently published new data saying transmission of COVID-19 wasn't happening at high levels in some schools in North Carolina they studied, and it was more of community spread, suggesting that schools could return safely. At the same time, many North Carolina school districts are still all virtual. Will you change your guidance and request that these schools give parents an in-person option now based on the CDC data?
Well, first, for any of you who've watched these briefings, you know that you've heard from me that our priority is to get our children back into schools physically. We know that it's better for them there and that they learn more and they get a lot more attention. We provided schools with the options of 3 different plans. One, of course, is still all remote. I'm going to ask local school boards and superintendents to study this data that has just come out. I know that our team is going to study the data and work with the State Board of Education. And I think you'll hear more from educators and from our health team in the coming days looking at that study. And just remembering that we do want to get our children back in school as soon as we safely can. And also remember that it is critically important that when children are in school, as they are in many schools across the state, that we keep up the safety protocols of wearing masks and keeping things clean and doing the things that we need to do to protect our children, our teachers, and staff members at school. Next question, please.
Our next question is from Steve Devane with the Fayetteville Observer.
Yes. Hey, Governor. This is Steve Devine with the Fayetteville Observer. My question is about nursing homes. I was looking at the report on ongoing outbreaks, and it looks like there's 70-some with more than 100 cases and 8 or 10 that even have more than 20 deaths. My question is whether or not do you think the state has done enough to get the vaccine out to these to nursing homes and similar facilities, and what would you say to folks who are concerned about that situation?
First, it's been a priority to make sure that the state of North Carolina protects people who are in nursing homes. And there's been significant work to help them when they have a case, to make sure that they quarantine people and to try to prevent spreads. But we know that in congregate living conditions that it's much easier for the virus to spread. But our team has been working with the providers all across the state. It's critically important that we get vaccines to staff and long-term residents. The federal government decided that it was going to run the nursing home vaccination program. So if you look on our data sheet, you'll see two separate, how North Carolina is running the vaccine program for everybody else, but the federal government is running the long-term care facilities. They've contracted with Walgreens and CVS. I was on the phone with the Biden administration and other governors, and in most states across the country, I think the long-term care vaccinations are moving slower than we would like to see. I believe the dashboard had about 84,000 had gotten first doses and very few had gotten second doses. So we told the Biden administration that we wanted them to pick up the pace as much as they possibly could, and we want to provide help to them to do that. So I think the state has worked hard to protect people in nursing homes. We're encouraging these vaccinations to occur. We know that sometimes when Walgreens and CVS has gone into some nursing homes, some people have refused it. And a lot of education efforts are going on to reduce and eliminate the skepticism that we know is out there among a lot of people, particularly communities of color that have a long history of having problems that give rise to concerns. But I think with this independent body approving these vaccines, they are safe and effective, and everybody's working hard to make sure that people get vaccinated. Dr. Cohen, would you like to add? Okay. Next question, please.
Follow-up, Steve Devon, Fayetteville Observer.
Yes, my only other question would be, do you regret that you didn't opt out of that program with the federal government? I think some states might have feel they've done better on their own. And was that ever an option?
I believe that all states are under the federal program when it comes to long-term care. That's not true? Okay, I'll let you take that.
Hi, Steve. I think we were not in the same position of a very few number of states who were differently situated because of relationships they had with different pharmacy entities that were based in the state. For us, CVS and Walgreens have been good partners. They've completed all of their first dose clinics, going through all of nursing homes and every long-term care site that signed up for the program. I think that they've been doing communication. Of course, we always want to see things go faster and we want to address hesitancy, but I think that given the scale of the activity and taking doses to our most vulnerable, I think they've done a very good job of completing all of their first dose clinics. Now they have to go back for second dose and third clinics to pick up those they may have missed in other shifts or new residents of our long-term care entities that might be there. So still a lot of work to do, but we continue to work with them in partnership. Thank you.
Yeah, we still want them to move faster. Next question.
Our next question is from Richard Craver with the Winston-Salem Journal.
Hello, Governor, Secretary Cohen. This is Richard Craver with the Winston-Salem Journal. I want to ask a couple questions. One is sort of a technical question to Secretary Cohen about whether her secretarial order has been extended. And then second, I know I'm getting a lot of questions from teachers and other groups wondering why they're not getting the ability to be vaccinated if given the effort to try to get the schools reopened, and you feel like that would be a logical step in helping that. So I was wanting to address that situation, given that today you had teachers vaccinated in Davie County, and I know there's a few other counties, yet other counties are not taking that step.
Yeah, thanks for that. And anyone 65 and over can get a vaccine right now, or eligible to get a vaccine. So any teachers who would fall in that category would be able to do it. But they're next in line.
Does remind folks to stay home whenever possible. I know our trend Our guidance to our local health departments and all of our vaccine providers is that we have a prioritization. And as the governor said, we are vaccinating those who are 65 and up, as well as all of our healthcare workers. We recognize, though, that there has to be some flexibility at the local level. We know folks, for example, had appointments scheduled before we made a shift to the 65 and up population. We wanted folks to be able to honor those appointments. And then, as was asked in an earlier question, we're trying to understand from our vaccine providers, where are they? Are they not seeing the demand from those who are 65 and up, and do they want to move forward to frontline essential workers, which are teachers, our police officers, and others? So we're trying to understand that. So there is some flexibility at the local level, but our instructions is to please stay within the state's prioritization. And again, that is for those who are ages 65 and up and all healthcare workers at this time. Thank you.
Next question, please.
Our next question is from Thomas Waybreck with WITN.
Hi, Governor. Can you hear me all right?
Yes, can. Thanks. Yeah.
All right. Thank you for taking my question. I have kind of two parts. First, do you think more of the state budget should be allocated to vaccination efforts with the demand for vaccines so high? And secondly, with the General Assembly back, how optimistic are you that we won't have another budget stalemate in this session?
Well, first, of course, we need more resources for vaccines, but what we need most of all is the actual vaccines themselves. The federal government has provided some help to us. We'll talk to the General Assembly about any state funds that need to be used for that, but we want to make sure that our providers have all the help that they need. We've asked the health departments, the hospitals, all those who are providing the vaccine, if they need help, we want to get it to them, and we want to make sure that they have everything that they need to quickly, equitably get these vaccines out. You know, I've spent time since the election talking to both Republican and Democratic leaders in the General Assembly. I don't think anybody wants a budget stalemate. The people of North Carolina voted and decided they wanted me to continue being governor and wanted the Republican leadership continuing to serve in the General Assembly. So I think we owe it to the people of this state to do everything that we can to find as much common ground as we can and to try to get a budget that we can agree on. That one that everybody knows is not perfect, but one that at least we can agree on. And I've talked with both Republican and Democratic leadership frequently. We talked as early as last week. Everybody is committing to more communication and transparency. I want them to have input as we develop my budget to present to the General Assembly, and we would like input during the process regarding what we want. Obviously, we want more health care coverage, more investments in education, working toward a clean energy economy, getting high-speed internet access across our state, a bond proposal that's going to help with infrastructure, schools, community colleges, and universities. We want to see those kinds of things, as well as help for businesses as we work to emerge from this pandemic. But I think we will be able to find some common ground. We did in my first 4 years as governor. We found common ground in a number of areas. And I'm going to give it my very best to make sure that there's give and take, that everybody has as much voice as we can at the table, and that we can come up with a budget and other legislation that will help move North Carolina forward. I think we owe it to the people to do that. Thanks. Next question, please.
Our next question is from Laura Lee with Carolina Public Press.
Good afternoon, Governor. It's Laura Lee from Carolina Public Press. I just wanted to revisit what Richard had asked about earlier. We know there are some Group 3 individuals receiving vaccines in parts of the state, and it sounds like some of that is attributed to previously scheduled appointments. But to be clear, do health directors and hospital administrators at the county level have discretion about when they are to move to Group 3, meaning some could move before others? And if so, have you given guidance on when they should be making that move, and or how they are going to determine if someone, will someone have to present evidence that they are in fact a member of Group 3?
Thanks, Laura. A couple parts of your question there. Let me start with the end of how do folks know what group they're in. And I want to remind folks that yesterday we put up a screener tool. You can go to Your Shot, Your Spot, Your Shot, nc.gov, and where folks can go through a series of questions to know what group they are in. It outlines exactly who we mean when we say frontline essential workers, and what group folks fall into. So that's the first on how do folks know what group they are in. And similarly, as I was saying before, for our local providers, we're working with them right now to understand, are you seeing a slowdown in those who are 65 and up coming in for appointments? Because the governor has been very clear, we need to make sure we are prioritizing speed and getting vaccine out. So we don't want to be holding our local partners back from getting vaccine out quickly. So we're trying to understand that right now. If we are we meeting that point where we're seeing a slowdown in those who are above 65? If we're not seeing that slowdown, we need to stick with this group because we prioritize those for a reason. These are our folks who are at highest risk from bad outcomes from COVID. Those who are 65 and up represent 83% of our deaths here in North Carolina. So we want to do a terrific job of reaching all of those who are over the age of 65. And again, our supply of vaccine is incredibly limited. So we do want to try and prioritize those who are over 65. All that being said, we recognize that there are different things happening on the ground with our providers. So I'd ask them to get in touch with our team. Let's have a dialogue about what they're seeing so that they can keep up that speed of getting vaccine out, but that we do it in the prioritized way. Thank you.
Next question, please.
Follow-up, Laura Lee, Carolina Public Press.
Thanks for that. So the information about how someone might determine that they're in Group 3 is presented in the materials you've identified. I'm just wondering, for the healthcare providers, for the health directors, health department directors, hospital administrators, is there a process or procedure for them to determine if someone, appears and says, I'm a teacher, I'm in Group 3? Is there some, requirement for some sort of evidence of that? And do they have discretion? It sounds like they do, to move their Group 3 ahead if they feel like they've accomplished what they need to with Groups 1 and 2.
I'm going to let Dr. Cohen come up and elaborate on that question, but I will say this. We want local health leaders and providers to stick with what we have proposed for the list of prioritization. We also know that things are going to get a little more complicated when you move into the essential workers. It's pretty easy when you're talking 65 and above and a healthcare worker. but it will get a little more complicated when we go into essential workers and defining those. And I think what we want is for there to be some discretion locally about who would fall into that category. We're going to give good guidance. The bottom line is that we want to get vaccine quickly into arms, and we don't want too much complexity to stop that from happening. Dr. Cohen, I'll let you elaborate.
Laura, you're asking the exact right questions, and in fact, we will have additional guidance going out to our employers, the employers of our frontline essential workers, to talk about what they can do to right now start to get their folks ready. So there are ways in which we hope that employers do partner with our local health departments, with our hospitals and other vaccine providers, because this is going to be a bit more complex than just pure going by age alone. So we're still working through some of those details, but do know that we're putting out some additional guidance, I hope as soon as this afternoon, maybe tomorrow morning. Thank you.
Next question, please.
Next question is from Katie Peralta-Silop with Axios Charlotte.
Good afternoon, Governor Cooper. This is Katie Peralta, again from Axios Charlotte. Had a question for you about non-hospital system vaccine providers. There have been a number of private HCPs who have applied through the state to be COVID-19 vaccine distributors. Tryon Medical in Charlotte, which has about 155,000 patients, is one example. What is the timeline for approving groups like that, and what role do you see these groups playing in helping to speed up vaccinations around the state?
Eventually, we want as many qualified providers as we can get, because our hope is that more vaccine is going to be manufactured, that more different brands are going to be authorized, and we're going to have more. And the Department of Health and Human Services is working right now to go through all of that. They are taking on providers as we speak. And I think that the ones that you talked about, they will be considering all of those, because we do want a very broad provider network. But I'll let Dr. Cohen elaborate on that.
Hi, Katie. The governor is exactly right. So as we've been talking about this week, we know our vaccine supply is so limited. We know that we're not even sending enough vaccine to all of the providers we have already enrolled and already having ramped up their capacity. Our providers last week did nearly 300,000 first doses. But we know on a go-forward basis, even with the bump up from the federal government we heard about last night, we're only getting about 140,000 vaccines for the entire state. So we know that that's going to have some limitations for all of our providers. So thinking about bringing on new providers, we want to be very strategic about it. We need to see where there are fewer access points and bring on those providers where we see lower access points, and particularly target those providers who we know serve our traditionally underserved communities, our historically marginalized communities across our state. So our team is going through that process. What I hope is our providers across the state get enrolled, get trained on our IT system so they can be at the ready. As the governor said, we want to be in a posture of saying, bring us more vaccine here in North Carolina, send us more vaccine, federal government. We are ready to ramp up. And so I think that's the work we need to do now, is to get our providers ready for when there will be more vaccine. But as far as new providers coming online, it is going to have to be targeted in the near term, just given the limited supply we have. Thanks.
Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. I wanted to know about the timing of the extensions on these orders and any changes because of the federal government and the new administration. Why is phase 3 through February, but then the mixed drinks through March? Will you spin things out like that, or make, say, the mask mandate, if you know that's needed through May, just make that now? And then with schools and asking the school districts to study the data, when can there be any sort of expectation of a timeline on that, since Biden mentioned May for when he wants schools open?
Well, first with the schools, I know the State Board of Education is looking at the data. Health experts are looking at it. We're talking to local superintendents. I think that's going to be really important. As for the dates of the order, we wanted to go ahead and give a month for the keeping of the protocols in place to protect the public. Always, if we look at numbers and we see things getting better and better, we could always move in and remove some of those protocols. But with the data as it is right now, we wanted to make sure that we had a period of time where we could continue to look at the data and make sure that we're protecting North Carolinians and send a strong signal that we still got a lot to do. As we're trying to vaccinate people, we've got to take the steps to protect people at the same time. On the mixed drink beverage order, we did that order until the end of March to give businesses a lot of predictability as to what they can do. We believe that this is a good economic boost for those businesses that have really been struggling, those that have indoor entertainment, indoor dining, where people have to take off their mask. Those are the places that have really been hit hard by this virus, and we wanted to make sure that they have additional income during this period of time. Next question, please.
Our next question is from Andrea Blanford with ABC 11.
Hi, Governor. We just learned yesterday that the state planned to give providers a predictable baseline amount of first doses that they can expect for the next 3 weeks. So how is that plan changing now that North Carolina will get more vaccine from the federal government over the next 3 weeks? Thank you.
Not much. We're glad to have the 16%, but we're going to go from 120,000 doses to 140,000 doses. So the staff will make decisions about giving the providers a little bit more, and they're working through those numbers right now so that they can let providers know. We're glad for this addition, but as Dr. Cohen said earlier, they worked very hard to get all of these first doses off the shelf and get with providers who could do the job to get shots in arms so we could show the federal government that North Carolina was ready for more vaccine. And they've done that. But now we're going to see a reduction because we are only going to have 140,000 first, really, there's fewer first doses in the 140,000 because the 140,000 includes some second doses as well. And by the way, a lot of people look at the CDC data tracker. When you see a certain percentage that the state has administered, remember that the state has to hold back for 3 and 4 weeks, whether it's Moderna or Pfizer, for the second dose, because part of what we receive is a second dose as well. So a lot of people will get a little bit more, but we're going to continue to work hard to get these vaccines out quickly and efficiently and equitably so that we can continue to take more in. Oh yeah, you want to add something? Okay.
Sorry. Let me just, Andrea, to further clarify. So the 140,000 that we are going to get every week are all first doses. So those are all first doses. We will still get our second doses in our normal allocation that will mirror 2 to 3 weeks later from what we get for our first doses. So we get 140,000 now for the next 3 weeks. Because of that, we're going to be able to give a little bit more to sort of this baseline minimum allocation that we are guaranteeing to our vaccine providers for the next 3 weeks. So it's a little bit more. We were at 84,000. We're going to get closer to 90,000. So it's good, but we're still talking about pretty small numbers here. Then we're going to use that difference between the 90 and the 140 to make sure we're getting balance across our state. We want to see how many doses that we're giving per population. We want to make sure we're reaching our historically marginalized populations, and we want to make sure that we are going with folks who are ready to distribute this vaccine. Again, speed continues to be a priority so that we can continue to demonstrate to the federal government that we are ready for more vaccine. I'm hopeful that with the announcement yesterday from the federal government of getting some more vaccine for the next 3 weeks, that there is an opportunity for us, if we can keep demonstrating that we can get through our first doses of vaccine, that we are ready to take on more. So a little more to that baseline guarantee that folks are going to get for the next 3 weeks, and then we will use the rest to fill in to make sure we're balancing across our population, going with folks who are using alternative community sites to reach our historically marginalized populations. Thank you.
Thanks for that, Dr. Cohen. Next question, please.
We have a follow-up, Andrea Blanford, ABC 11.
Yes, thank you for clarifying that. And Governor, one more question for you, because you mentioned earlier this afternoon that you're encouraging providers to move to an appointment-only protocol. Can you elaborate on that? Or are you planning on making that mandatory statewide to cut back on some of these long lines that we've seen?
We're not saying appointment only. We're just encouraging appointments, and also encouraging it once you fill up appointments for the anticipated vaccine that you're going to get. We're also encouraging waiting lists so that people can understand that their name is on and that their name can be called soon. So there will still be events that are not appointments, but we encourage that because it's much more positive. The vaccine provider really knows what they have and how much that they need to distribute. So that's what we're doing. Next question, please.
Our final question is from Will Michaels with WUNC.
Hi, Governor. Will Michaels at WUNC. If I may just build off of Laura and Richard's questions, how much oversight does the state health department have when it comes to equitable over local health providers, when it comes to equitable distribution? In other words, is there a mechanism by which you can track, or do you actually know how many doses are going to the current priority groups and how many might be going to other priority groups or friends and family of clinic staff who may be on, say, a last-minute wait list? How do you hold providers accountable?
Well, first, when we say equitable, we also mean making sure that vaccines get to underserved communities. And that's something that's in the plan and its instructions to providers. And that's something that the state will know whether they've been able to do. And I think everybody's working together, but the state is going to be working to insist on that. And I'll let Dr. Cohen address the various groups.
Hi, Will. Thanks for that question. So yes, we work very closely with all of our vaccine providers. Again, as I keep saying, we want folks to be working on prioritizing folks who are 65 and up and healthcare workers right now. And so we'll continue to reiterate that. But at the same time, we recognize on the ground realities, we need to be open and flexible. So we encourage folks who feel like they are moving on to the next group, please to have a conversation with our team so we understand what their plan is. Are they honoring appointments that already were in place, or is there something else that they're seeing on the ground that we're not seeing? And so we're asking those questions of our providers right now so we know as a state when we need to move into this next phase of prioritization. And what I would say is we're also working towards a place where we can be transparent with everyone about our race, ethnicity, gender, age data down to the county level. As you know, that data is already on our dashboard at the state level. Our providers need that data so that they can make sure that they are targeting their efforts appropriately. So we hope to have that by the end of next week on our dashboard. Thank you. Oh, there's a follow-up, Will?
Yes, my follow-up, Dr. Cohen, is just, does the state health department have any similar oversights over the federal program for distributing vaccines to nursing homes or long-term care facilities? Do you have any similar oversight, or is that federal government only?
Federal government is managing our long-term care vaccination programs through their two vendors, CVS and Walgreens. Their parameters are pretty specific to say that they should be vaccinating healthcare workers who work at the long-term care facilities as well as the residents. So that those parameters are pretty clear. But at the end of the day, we do not want any vaccine wasted. And because of the shipping and the handling of these vaccines, when you take them out of the freezer, you can't put them back in. So we don't want vaccine wasted, but going out of a priority order should be a very unusual circumstance. It should not be the thing that is happening each and every time, but we do not want vaccine wasted. So we recognize that there are some places where we want to just make sure that we get vaccine into arms and not wasting it, but at all other times, we really need to focus on those priority groups. Thank you.
Thank you for being with us today, and stay safe, everyone.